University of Utah is making healthcare visits easier for patients. Nisha DeGaring explains.
University of Utah's Rocky Mountain Center for Occupational and Environmental Health is open during COVID-19 and is offering virtual visits right now for patients. Dr. Eric Wood is joining us now with more information. Dr. Wood, thank you for being here and tell us how things have changed where you do business there over the past couple weeks.
Well, thank you for having me, Nisha. It's really good to be here. So business has remained open for us throughout the entire pandemic. Things have slowed down quite a bit as less and less workers are being out in the community getting ill or taking care of their routine care as well. But we've continued to have our presence at the Redwood Health Center, and then we have slowed down our business at our other two clinics, which is at the South Jordan Health Clinic and the Orem Parkway Clinic.
If people need you right now, tell us about these virtual visits. Talk us through one. How does that work?
So this is something new that we've been doing over the past couple of weeks as well, and we're using some of the newer technologies to reach out to people either through their smartphones or through their computers at home. And how we do it is in advance, we'll schedule a time with the patient, and then as that time rolls around, there'll be a call initiating to the patient to let them know that the room is ready for them, the virtual room is ready for them. And then the doctors will call the patients, and then we'll go through with a video conference to help the patient out with where they are in the course of their injury or illness, so that we can hopefully help them, despite not being able to see them in person, with the recovery plan. So what we're trying to do is keep patients out of the clinics as much as we can, where there are people, more close contact, and some who may have COVID or could be walking around as well. So that will help us kind of keep those patients from being more exposed potentially to the illness themselves.
Dr. Wood, what kind of care do you provide?
So we focus primarily on injuries and illnesses that occur when people get hurt at work. So we see a lot of musculoskeletal type injuries, cuts, eye injuries. Sometimes people will get rashes as they're beginning to work with these disinfectants that we're seeing being used so widely in the community now, as we need to make sure our surfaces are clear of potential infection agents as well. So all sorts of things of that nature. And then we take care of the public safety workers quite a bit, so making sure they're healthy and safe to go about their work as well.
So as employees are starting to ease back into work, what's your advice on keeping them safe?
So a lot of the same social distancing norms that we're experiencing and getting practice with in the community are going to be their workplaces are going to need to make sure that they have those in place at their own environments as well. So the employers are going to have to make sure that they try to set up their workplaces so that they can keep that 6-foot distance in the individuals working amongst each other. They might need to think about new ways in terms of approaching how they're staffing their businesses as well. Instead of having one shift so that they can have people more spaced apart, they might think of adding another shift. So continuing the same production methods, but decreasing the amount of exposure that the employees at work will get. And then also having things available for their employees too, making sure that they have masks on in their facilities, making gloves available perhaps if they have those, and certainly if there is contact with the public, potentially making some kind of changes so that there may be shielding, like a lot of us are seeing in the supermarkets, for instance, or the drive-through food places that we still continue to go to.
Definitely a lot of good things to think about, everybody. If you have questions, University of Utah's Rocky Mountain Center for Occupational and Environmental Health. Don't forget, you can go there for questions, and that's their website right there. We'll link you from ours, abc4.com. Dr. Eric Wood, thank you so much for joining us.
Well, thank you so much for having me, Nisha.